Hello, are you MBBS students wanting to go for residency in United States but struggling with USMLE? I'm Dr. Tushar Devras, Chairman, Astute Academy. USMLE, United States Medical Licensing Exam, is one of the most important examination. It is a licensing exam. Definitely, it is not used for admissions much. 15 to 20% weightage is there for the admissions part. Residency is world's #1 program. It is not a difficult program. The admission processes has to be understood. But before we go to the admission process of the residency program, the critical part where most of the students stuck is the US Medical Licensing Exam, USMLE. Now, USMLE has got 3 steps. The step 1, step 2 CK, that is clinical knowledge exam, and the step 3 examination. Normally, it is expected to take step 1 and step 2 CK. But these examinations are very, very peculiar. From 2023, the USMLE, that is the original body NBME, has completely revamped this examination. Earlier, it was more of a theory questions. Now it is 100% clinical. What does that mean? If you can diagnose a patient, you can treat a patient. So your diagnostic skills will be tested through the USMLE. They have changed the complete examination pattern. They have changed the type of questions. Their expectation level from the students are completely different than before 2023. Now, most of the students are still in the same league of 2022, or they speak to their seniors, and seniors are telling, or a lot of in India, NEET PG coaching classes are trying to teach USMLE. NEET PG is completely different examination than a USMLE. USMLE requires completely a different parameters. So let's understand what is USMLE. What is the examination pattern? What is the paper setters are looking from you? How you are going to address the USMLE? What is the peculiar part of USMLE? Complete process and how you can get an excellent score in USMLE. So I'll be taking a webinar on 9th May, and you may be busy during the day, so I'll be taking at night at 9 p.m. So you finish your work during the day on 9th May, 9 p.m. at night. At a leisure, we are going to discuss the point on USMLE. We will be taking series of the webinars on different topics, from the residency admissions, which is we have been doing for last 25 years, to even the application processes for that, how you should be preparing for the research. I told you 20% weightage is for USMLE. So what is balance 80% for the residency? We'll be discussing in a different video series. So the first one we are coming on 9th May. Let's first discuss USMLE, which is going to be not very difficult, but again, a very, very critical examination, because you may be knowing once you pass USMLE, 7 years you cannot repeat. 7 years is a too long period. And I have seen large number of students stuck because of the low marks. You pass it. Like a NEET PG, you qualify NEET PG, but you are at a bottommost student. You may not get a premier college into that. Do join in large number. I am Dr. Tushar Devras, USMLE examination strategist and residency admissions expert. Will be helping you, and we will be very, very happy to go throughout. Thank you.